We've had several patients that have had headaches for more than 20, 30, in one case 40 years, that have been to multiple doctors, been to the Mayo Clinic, been to the Cleveland Clinic, and haven't had any relief. We were able to identify several areas in the neck that had this little bit of ligamentous instability that was causing the muscles to constantly fire and be stiff and achy, causing radiating pain up the head. Resolved within a handful of treatments. Oftentimes, the problem isn't only with like the intervertebral discs, like you hear about people having disc problems, but oftentimes the pain is coming from tight muscles and also from damage to the ligaments. So you say, well, how does this happen? How do we get damage to the ligaments? How do we get these tight muscles? Well, over time, all of us have various types of trauma. You know, we're in car accidents, we're active, we get injuries. And what happens is when we get those injuries, we stretch our ligaments and they tear a little bit. The problem is that that's sore. So what do we do whenever we get musculoskeletal aches and pains? We take ibuprofen, we put ice on it, we rest it. Unfortunately, that's not good rehabilitation. So what happens is when we do those things, it actually reduces your immune response. So well, what is my immune system? Isn't that what I deal with when I'm sick? Well, actually, the immune system also helps rebuild your body when you damage it. So like, let's say that you're very active, you go out and you sprain your ankle. When you sprain your ankle, it swells up. Well, what happens, that's your immune system coming into the area, breaking down the damaged tissue, stimulating your body to rebuild new tissue, and unfortunately it's painful. That's what people don't like. So what do? They put ice on it, they take anti-inflammatories. The problem is it blocks that healing process. So then what happens is when we don't adequately rehab after injuries, after car accidents, even after repetitive trauma, maybe you sit at a desk all day. If you sit at a desk all day, you're always on a computer and you get that constant ache, oftentimes that's from the muscles. But again, it's not just the muscles, because what happens, we have damage to those ligaments. The bones are able to move just slightly more than they should. We're not talking about dislocations or something like that. We're talking about having bones that aren't quite as stable as they should. Your body knows this. You say, well, how does my body know about a millimeter? Look at a popcorn kernel. If you get a popcorn kernel stuck between your teeth or even close to your teeth, think about how much that bothers you. Your body is built to very tight tolerances. So when you get just a little bit of laxity in those ligaments, your body knows. So what does it do? It tightens up the muscle to bring stability to the region. So what happens when your muscles stay tight all of the time? They get sore. What happens with sore muscles? They start to cause pain. They start to cause headaches. They start to cause tension. You know, how many people do you know that complain of tension in their upper shoulders and neck? Yes, sometimes it is stress, and we have a lot of videos for that. But oftentimes it's due to small little injuries that just haven't been fixed over time. So what we can do to help that is we can go in and we can do regenerative injections. Now we have two major types of regenerative injections. They both work in a similar way. What we do is we go into those painful ligaments with a small needle, and we inject a substance that stimulates that immune process in your own body. So what we do is we go in, small needle, we inject the area with a solution to stimulate your immune system. So the area does get a little stiff and sore for a few days, but that starts your body working on healing the underlying cause of your pain. We do this, two primary injection methods. One is we use dextrose, which is a corn extract, a form of sugar. What the dextrose does, it opens up some of the cells. That activates that immune system to come in, the area swells up, we start breaking down that damaged tissue, and we start stimulating your body to lay down new tissue. The other way that we do this is using platelet-rich plasma. In that case, we draw out some of your own blood. We add a little bit of anticoagulant just so it doesn't clot. We spin down the blood and we take out the growth and healing factors. So the same factors that we're trying to bring to the area, we can extract out of your blood and inject that into the damaged tissue. This causes the same immune response that we talked about. The nice thing about PRP is it's a stronger treatment. You say, well, why is that? Well, because it's your blood. You see, the dextrose, as I said, it does open up some of the cells. Well, I have to dilute the dextrose down so it doesn't damage your other tissue. Whereas your own blood product, I can inject in full concentration. So both of these treatments can be quite effective. So the nice thing is that also when we have referred pain from ligaments in the neck, we can also oftentimes do what we call a diagnostic injection. We can take a little bit of numbing medicine, the same stuff that you would get if you got stitches in the emergency room, and we can actually numb up the ligaments and see if it changes your pain pattern. So that's a great way to see if ligaments are contributing to your pain, neck pain, headaches, back pain.